Welcome to the office. Mr. Ray is coming from up north. We got a lot of things going on here, Mr. Ray, okay? And a couple of things we're finding. He's coming, there's a lot of back pain and instability, and I'll show you the x-ray in a minute. What we're finding here is C7 left side, C1 left side, C2, C1. 8 points on the base of the neck, 8 to 10 points in the upper. When we start to come down the spine, we're getting 5, 6 points, 7 points, 8 points, T6 area. And all of this is starting from what happened in his low back. And it's very interesting when we look at this x-ray, what's going on here, dude. 5, 6 points. So we have tailbone, 6, 7, base 6, 7, and C1. When we come over here and look at his x-ray, there's a lot of imbalances going on here. He came for his low back, and when I see this, it's called antalgic posture. You're leaning away from the pain. Typically antalgic posture with a sacrum issue is where you see them hunched forward, which is what you're doing. Mm-hmm. On this profile, we can see we curve from right to left to right to left. We have this kind of S shape, snake shape, right? Serpent shape, or this curve. And all of this came from whatever happened in your foundation. Second thing is your digestion is very bad. And you brought me a report that said low bone density, right?
Right.
And so we know that there is low bone density. And the way I was trained, low bone density comes from bad digestion. So it's not about giving the patient calcium for low bone density. Mm. Calcium is in all the foods that we eat. It is ubiquitous everywhere. It's having the right HCl to pull it out of the foods, okay? Mm-hmm. So if we don't fix the digestion, the bone density is going to get worse. So I see this case very simple for here. It's a foundation and a digestion case. Mm-hmm. Simple, okay? I don't mean it's simple.
No, I understand.
It's a lot of work. But in terms of, we're not here chasing all these pains, okay? I want to be very clear.
Right.
You have a structural component,
mm-hmm.
you have a chemical component.
Mm-hmm.
The structural component, you're here for about a week. We'll start working on it. Now, if we go close to this L5 and look, I mean, I'm assuming, as you said, there's desiccation.
Yeah.
Now, I got my cool little new models here that I will explain and see where you are at, okay? This is stages of spinal degeneration. This is a normal, healthy disc, normal, healthy joint right there, okay? This L5 is here at phase 3. And at phase 3, what do we see here? When we compare a normal disc here to this, the nucleus is what? Worn out.
Right.
The fibers there's a lot of adhesions in the fibers. Mm-hmm. There's osteophytes that have formed here as well, right?
Right?
And all of that is because of?
Not enough calcium?
No, out of alignment.
Alignment, I see.
So that's how it all started. But there's still movement there. That's the good news. Okay? We can still move the sacrum. Okay? If we go back here, you can see. This is an old, I would say, like I said, about 35-year-old, maybe more injury in terms of this L5. And all of this is a result of down here. Okay? Next, I want to talk about is going up the spine to the neck here. And when we look at 2, 3, 4, C5, C6 is also posterior. And C6 controls the shoulders, the elbows, the hands. Okay? Make sense?
Right, yes.
All right. So the major I see here is the tailbone, number 1. I'm sure we're going to find something in the middle of the back here. Okay. This knob here is calcification of the arch of the aorta. So we really have to go into your nutrition this week.
Okay.
That's going to be a big focus for us. Okay. Today, let's examine your spine.
Okay.
And let's figure out where we're going to start.
Sure.
So we found pressure readings at 1, 6, 6 in tailbone. This is your L5. Come back towards me, sir.
Oh, gee.
pain, right?
Yeah.
That's sacrum. More pain there.
Yeah.
That all,
This one. Yeah. This more pain.
That's 5.
Okay.
That's 1. That's 2. That's 3. That's 4. Not so bad here.
Not for so bad.
This is 1.
One is very bad.
That's 1.
Yeah.
We have 1. We have 6. Let's check up here. 1, 2, 3, 4. That's 6. That's 7. 6 more. Yeah, 6.
Yeah, 6.
6.
More painful.
7. Okay. T6, S1. Sit back for me, Reza. There you go. Can we take this out of
Oh, sure. Sorry.
That's all right. You got a SWAT hat on. Right there. 6. Now, let's turn to the left. Let's turn to the right. Let's look down, isolating the upper cervical. Turn left is fine. Turn right. Look up. Turn left. Turn right. Okay. Alright. Here's the game plan for today, okay?
Okay.
C6, T6, S1.
Okay.
That's the game plan for today.
Okay.
After I do those adjustments, I'm going to do your ankles,
Okay.
okay? And then I'm going to do the machine on the back to break up scar tissue.
Very good.
I don't want to mess with anything else just for today.
Okay.
I'm off tomorrow, Sunday, so I don't want to add
Sure.
any extra variables.
Okay.
And then starting on Monday, we're going to get a little more aggressive.
Right.
Okay?
Perfect. Good plan.
Tick?
Very good.
You ready?
I'm ready.
Yalla. Hurry! Yalla. Chalo. Let's go face down over here, sir. Shasha! So apparently I had a video, right? A year ago. And that one video got 40,000 new followers from Tehran. I'm tripping, dude.
On what?
Some video on Instagram.
Oh,
Yeah,
gee.
some video on Instagram. 40,000 new followers from Iran.
Believe me, if you were there,
Slide
you
up.
know,
Slide up.
you couldn't even go to bed at night, you know.
I can't go to bed at night
No,
here.
I mean because of patients, you know.
I know that.
There's so many, like my sisters were asking me about, you know, chiropractor and things, the way things, and they said they don't have it over there.
Relax your hands down. There you go, sir. You ready for me, boss? T6. Nice and easy there. Start there.
Oh, gee.
That's the home run. Okay. Auzubillahi minash shaitan.
Oh, God. Very painful.
You gotta drop it down, brother. Drop that shoulder down, okay?
Okay.
I'm gonna use the drop board.
Okay.
Actually, no, I'm not.
Oh. Oh, God.
A little more. There you go.
Oh, God.
Bus. We're gonna need the drop. Bear with me, okay, sir?
Okay. Oh, God.
That's the home run.
Oh,
Gotcha.
God.
Let him go. T6, S1. Let's raise him up. Hang out, sir. Wait for it, please. Take a nice deep breath in. No rush. Let's put your glasses on. We got you.
You know, the reason your YouTube is not seen as, doesn't have the same number, YouTube is blocked over there. You know, Instagram is the only one open.
Understood.
Did you know that?
I did not know
Yeah.
that.
YouTube is blocked. They have
Yo, peeps, get me on Instagram. Come off. Walk. Deco. Check it out. Walk 2-3 times back and forth, sir. Look straight ahead when you walk.
Okay.
Don't look down. There you go. Sitting up a little taller.
It's for sure different, yeah.
Yeah, dude.
But still I feel some pain, you know.
Sure, 35 years.
Yeah.
Gone in 2 seconds, of course. Keep walking, sir.
Okay.
Keep walking. Doo-doo. Very different.
Very different, yes.
I'll let you
Very
wear your
different.
hat now.
Thank you.
They'll think I was taking care of SWAT. Keep walking.
In fact, when somebody gave it to me, you know, I laughed. I said,
Keep walking.
okay.
Keep walking. Shukr. Have a seat over here, boss. Back over here. Let's work on his neck.
Okay.
Thanks. Alrighty. All the way back, sir.
Okay.
C6. Can I get a hoo-ha? I didn't know they were blocked.
Yeah,
over
they were
there.
blocked because there are all kinds of things, you know.
Yeah.
On YouTube.
Alright, so we need to put some stuff, more stuff out on Instagram.
Yeah, Instagram and WhatsApp, you know. Some of those things are open.
There we go. C6 underneath the spinous. Come right underneath there. Lift up. Left ear down. You gotta let it go for me.
Okay,
brother.
okay,
Come
so.
on.
Oh,
Wow, it's stiff. There you go. Let it go a little bit more. Relax the shoulders.
Okay.
Relax. There you go. He's feisty. A little bit more. Oh! Back over here, sir. You're gonna make me work for that one. Face down. Let's do C6 prone. So when you don't get it in the chair, go for the prone. I think it's just because it's degenerated, it has a lot of calcification.
Yeah, I
Slide
think
up,
so.
slide up. There you go. Chin down. Look down. Look down. There you go. Relax the shoulders. There you go. Gotcha. Come off slowly and let's walk it off. I'm going to have you get off by yourself. I want to see.
Okay, sure.
Easier to get off, right?
Yes, it is.
More
yes.
stability.
Yeah, yeah. More stability. Good way of putting it, yes.
More stability.
More stability, yes.
And that was what I said from the beginning.
Yeah.
We need more stability.
More stability, yeah.
If I can get you stabilized,
Yeah.
you can walk.
Yeah.
If you walk, you're going to feel better.
Right, right.
Walk one more time, sir.
Right. Sure.
Telecommunications, huh? That's
Yeah.
funny. You know, when I was in, what grade was I in? Grade 9. They had the counselors telling you what careers you should go into after doing an interview with
Right.
you at school, isn't
And
it?
telecommunication was one of them?
No, they said you should be in telecommunications, Rahim.
Really?
That's what they told me.
So, I'm
I
glad
am,
we didn't go
but
there.
I am.
Otherwise, we would be competing.
No, I'm helping your body
No,
communicate.
no.
And I'm doing it through
Oh,
social
I see
media.
what you're saying.
Ah!
I see what you're saying, yeah.
Yeah, but all right, let's recheck.
I'm sure you could be successful in any of those areas too, you know.
I was like, what? You want me to start a cell phone paging business?
It's more than that, you know.
No, I know.
The infrastructure, you know,
I-
is way, and this is nothing that people have in their hand, you know.
Right. Neck is clear. Your C1 cleared from a C6 adjustment, okay?
Great,
Clear and clear.
great,
T6 is clear.
great.
Kubi!
That's it. You know, there's so many still common things culturally, you know, like food still.
Yeah, like
food's
Navroz.
the same, no rules.
Like Navroz.
Yeah. Even poetries. I was in Amsterdam.
My daughter's name is Rumi.
Rumi, really?
Yeah.
Does she know
She
whose
does.
name is
She
after?
does.
She does. So that's great.
Yeah, dekho. Watch this, sir. Come back. Back. Punch. 5. Look. Look.
Yeah, I have no pain.
Come on, dude.
Really, less pain.
Come on, dude.
No, believe me.
Come on, dude.
Yeah.
Is that what you came for?
I came for the whole thing.
Let's do the ankles, okay?
Okay.
Ears as well for balance.
Okay.
On your back, please. Raise your right leg, please. Left leg up. Down. There you go. Sit up and turn. Stand up fast and walk. Check it out.
Much better. Much better. One can't believe, Much better. Much better.
Walk it up.
I don't know what you did, but what you did is
जादू है
जादू है
ये जादू है भाईजान ये जादू है. Let's check your hands now. Squeeze. Relax there. Squeeze. Squeeze. Elbow inside. Relax there. Let it go. There. Relax the elbow. Wrist. There. Over here. Squeeze. Radial head. There. Lunate. Scaphoid. There you go. Thumb. Squeeze hard. Yeah, you got your deal closing hand back.
Yes, very good.
Okay, that's where we're going to start.
Okay.
I need to do the buff and polish now. Have a seat. Let's break up scar tissue. Somebody asked the RPMs on this. This is 10,000 RPMs or 170 to 180 hertz frequency, okay? And the idea of the vibration machine or vibration therapy is to break up scar tissue and get that circulation going. This isn't going to do the muscle like the percussion devices.
Right. After all these sessions while I'm here, Dr. Rahim, anytime you tell me, I can, again, if needed, to fly to here, so.
Sure. All right, brother. You're all set with me, okay?
Thank you, sir.
All right, stand up for me, please. Squeeze again. Any questions?
No, I'm
We're
good.
clear?
I'm good.
Welcome
Yes.
to the office.
Thank you very much. I appreciate it. This just one session. This is the first time I'm here.
Yes.
Driving, coming from, Modesto. Just this one session took care of much more of those 2 months, 3 visits a week of those new car,
Well, we're not. It's not about comparing techniques.
I don't want to compare,
The idea-
but just what I saw.
The idea is what is the issue,
Yeah,
okay? And we found what the issue is
right,
structurally,
right,
and that's what we're working on,
right.
okay?
Maybe I was not a good candidate for that method of,
Possibly.
thing, possible.
Possibly.
But I'm just saying my own. I'm not really want to put anybody's
Yeah.
down or anything like that.
Philosophy is this though, right? And the philosophy in the Gonstead work, it's about foundation. You don't have a right foundation, nothing else going to
Nothing,
hold.
no.
But when you're looking at upper cervical techniques and methodologies and philosophies are everything happens from here because the message isn't coming from the brainstem.
Right.
And this is what's causing this. So it's a difference of philosophies.
Right.
There are a lot of people I know, thousands and thousands of people who have had their back fixed with an upper cervical.
Right.
Tens of thousands, hundreds of thousands.
Right.
Okay? And again, then there are other people who don't respond.
Right.
Vice versa. If it's a foundation issue, you got to work on the foundation. If it's an upper cervical issue, you need to work on the upper cervical. If it's both, you need to figure out where to start. And that's what we did today.
And another thing, Dr. Rahim, I don't want to take too much of your time. When this thing is getting toward, like the pain is going to be reduced so you can walk better or something, it's really, the progress speeds up, much faster, because then for years I could not, 2-3 years, I have never been able to do any exercise. I used to go to gym almost every day.
Yeah.
Now I cannot, and all these kinds of things that stuck, something like that, is because of, no activities. So it's just your help opens up, a big window, a big door, for better and faster progress.
But now you have to do the work,
I
right?
have to do the work.
That's not on me.
No. But you at least, will tell
Jumpstart.
me.
Jumpstart.
Yeah, you tell me what to do and what's good for me, because I need to know, because if you tell me don't do anything right now for 3 weeks, to just go and lie down, I will do that, so it's very important.
I'll have all the instructions for you outside.
Thank you, sir.
You're welcome,
Thank you.
sir. Welcome to the office.